Dr. Lopez. Throughout my exam, throughout I was in exam hall, I kept on hearing your voice, Dr. Lopez. You are such a gift to the PMHNP world. Thank you for all you do. Appreciate you
You
so
know,
much.
like, I mean, I don't know if you can see my goosebumps. Like it is emotional. It is emotional
Thank
because
you.
this is the most important test of our lives. I mean, this is where separates you from RN and your beautiful life. So I get for every one of my students, anyone that's enrolled in my course, if I have one that have not passed, which is very rare, I I lose my sleep because I think, where did I lose this person? Right? If you follow the formula, it's 99% or even better to pass.
Yes. Oh,
But
yes.
you have to do the work, right? I don't have all the answers, but the course is really solid. It's really solid. People are taking on Friday one test and take another one on Monday for both, and they're passing both each time. So, by the way, I couldn't see your name. Is this Lola?
No, this is Kemi. Lua Kemi.
Oh, Kami. Okay, great.
Yeah.
Because Lola just
Yeah.
passed yesterday. She sent me an email.
Yeah,
So
she
that,
did.
yeah, yeah. So that's a lot of you guys are just making the mark and then getting your green check, and then you don't have to worry about anymore. So what
Yeah.
did you find helpful about the course? Is what
Oh,
it
I
was?
just say
What can you give us?
everything because I started with I did all the modules, or
Okay.
the diagnostic test 1 and 2. Very important, very important, because most of the questions in that diagnostic 1 and 2, I saw most questions from those two, and also the question bank is very important. I did the question bank. I did both diagnostic 1 and 2 twice, and question bank and all modules. I did and then I did the videos as well. The videos with the where you did one-on-one with those students that you uploaded there.
Oh,
Those
uh-huh.
ones, in fact, I listened to that video while I was driving this morning to Baltimore. I live in
Oh,
Bowie, but I drove to Baltimore. I listened for 1 hour with that other guy. It was really good. I'm telling you, most questions came from that thing. Even what we were talking about yesterday,
mm.
about who to report to. Are you supposed to tell the parents or the police? Oh, I'm telling you, most questions came out. So I
Wow.
was hearing your voice throughout that examination, Dr. Lopez. It was just funny, but thank God, here I am.
That's
I just want to say
awesome.
thank you. Yeah, yeah,
That's so awesome. I thank you so much. A few things that you said, it's so important, and I struggle with this a lot. I really struggle. Because you said the diagnostic test is very important, right?
yes.
So that being said, why do we have like 50% of our students not completing the diagnostic test too? I I don't get it. I really try to find this answer. This is like one of the most uh incognito uh answers that I can't find, because people are not doing the test too. They do test one, it's free, it's part of the course, and they still not doing it.
Oh
50% of the people are not doing it.
no, you need
The
to do
second
test
thing is,
two. You
go
need to do
ahead.
test two because that test two
Yeah,
is really hard. It's really hard,
it is
but
hard.
it's important that you do it. And if you miss it, go back and review it. It's important.
Very important. And then a question. I was talking to one of the students this morning. This morning for me, it's a Sunday morning here. So, and she said, "Can you give me the answers to the test?" I said, "No, I can't, because I want you to go back in the PDF and look at the subject, right? So if I give, I'm not doing the benefit for you. I want you to actively recall the information."
Yeah.
And this is the reason why I don't give the answers on the PDF. I even didn't want to give any PDFs for the crash course review. But I'm trying to find the balance where I can give you the most and not be harmful to you because I'm giving too much. Because if we all, human nature, if we all receive, then we have no concerns about anything, right? So we
Yeah.
have, and the most important thing is that you are able to recall the information. But what you said that you hear my voice is probably what I is the most common feedback that I get it. People are like, I was hearing your voice throughout the course, throughout the test, and that means that you really pay attention. That means really that the information that I provided, it's you are able to connect with that. So very, very helpful. We have someone that thank you so much. It's a huge pleasure when I see students coming back and posting the certificate on Facebook. So most of our folks that they pass and they posted on our WhatsApp group, which is great. But if you can, let people know, hey, you were here, there are choices. People can go anywhere, but we're definitely here and we would love to help everyone as well. So
Absolutely.
yeah.
Thank
So yeah, thank you for being here today. Quick question here. I have someone asking if future PMHNP, you have a question, please ask what is the question.
I'm able to get into Kahoot, Dr. Lopez. Good evening.
Yeah, good evening. What did you do that you're not able to get into it? What are your
This
steps?
is the first time I download the app Kahoot 8, and that's it.
I have. You can do it, the Kahoot app, but if you go to www.kahoot.it, you gotta open your browser, and they should pop up.
Okay.
And then you enter the PIN code.
Okay, let me try that then. But
Okay.
you guys can continue without me.
Okay, we're about to get started, everyone. Just one final question. Future PMHNP, you have your hand raised. What is your question? If you have to unmute yourself, we cannot hear you.
Okay, I found it now.
Okay, great. Glad that you're in. All right. Future PMHNP, if you have a question, please ask. Otherwise, we're about to get started.
What did you say the pin was again?
807-9894. All right, guys, we're about to get started. Final comment, and I'm sorry. I just want to see you guys to pass. So please email me. If you ever feel stuck, if you ever feel confused about the topic, if you have doubts, email me, right? I answer about 20 to 30 emails every day. And what I'm going to start doing it soon is getting all your emails and sending a massive response when somebody has a question. So this may help you too. For example, if somebody asks a question about adjustment disorder, I'll repeat the question and I'll send it to your email. If you don't want to receive emails, please write me back. Say, hey, I don't want to receive emails. So that way it doesn't look like spamming you. I don't want you being inconvenienced. Okay, I just want to give you more all the time, but I don't want to be inconvenienced. So please, if you get an email from me and you don't want to receive email, just write me back and be like, hey, I don't want to receive emails, and that's fine. My feelings don't get hurt if that happens. Okay. But what happened is, I feel that if a student has a question, that question is probably important for the student. So why not share the question? And I will not put your name. I will not say that you asked the question. I'll keep your privacy, okay? But I want to share that, start doing that, getting those questions and send it out. I don't want it to be too much, but I want to share the information to others.
Dr. Lopez, Can you hear me?
Hey, good evening, good morning.
Sorry, you couldn't hear me at first. I couldn't figure out my microphone. Okay,
yes,
I just have a quick question. I'm sorry.
Okay.
When do we take the diagnostic 2 test?
Okay, very good question. Everyone, please pay attention to that. How I would do it, let's say I would set in my mind that my test is on the 20th. And that would be my test date. However, the true test date is the 30th. So the 20th, you take the diagnostic test too. But why? Well, let's say you score 75. That's a good score, but it's not what I would like it to be, 80. So now we have 10 days to catch up, to work together, and for your test day on the 30th. But in your mind, when you sit down to do the 175 questions, 3.5 hours, you set that as your test date. This is how I would do it, because I wouldn't want to have 10 days to refocus one subject or another, your weakest point. And then we can work together through emails to get you there, to get you to a 90 score. Does that answer your question?
Yes, thank you.
Yeah, I mean, this is my recommendation. 10 days before your test date. Now, if you can do 1 week, it's okay. If you can do 3 days, it's okay. But it's not okay if you can do the night before, because this does not give us enough time to readjust any strategies that we may have to, right? The test is not easy. The test is not easy. And I ask you guys to aim for 80, but why? Well, I'm accounting for some distress during the test day. I'm accounting for anxiety. I'm accounting for long questions that you may lose your interest. I'm accounting for you to feel discouraged if you find a question that you don't understand, which is all valid. That's why I ask for a little bit more on a practice test to make sure that you feel good, you're ready for the test day. Okay? Awesome. All right, guys, we're about to get started. Kahoot, you answer on your phone. You answer on your phone. It will show up A, B, C, and D. You answer on your phone, and you are good to go. Now, you get more points for being fast and correct. If you only correct, it's okay. But if you're fast and correct, you are good to go. You have 1 minute per question. Good luck, everyone. Let's do this right now. Module 5, review from yesterday's event. It's a hard question, okay? This one will get a lot of people. Very hard question. Okay, as I assume, very hard question, right? So if you're any of my classes, I say that developed safe planning, it is a high priority, right? So anytime you hear safety planning, this is high yield key is the safety planning, because the safety planning is a step-wide process to decrease crisis. Now, admission, you are taking someone's freedom away. If the question said it definitely impose risk to himself or others, then an admission would be likely. This is a likely an admission, but before the admission, you still do the safety planning and see if you can collaborate with the patient. For example, last Monday, I admitted 5 people. I had a busy night. Out of those 5 people, I actually had 10 patients coming through the ED. 5 of them, I conducted safety planning. They still had suicidality. They still had issues and concerns. And 5 I admitted. Out of the 10, I've seen 10 patients in AD. 5 of them I admitted. 5 of them I conducted safety plan for all of them. But out of those 10, 5 I admitted, and 5 I sent home with a follow-up with next day in the clinic, right? So basically, If the patients are able to do safe planning, then it's likely not to be a discharge. However, if they cannot do a safe plan, then there's an admission for sure. Okay, I know this was a hard question, so hopefully this answer helps you have a little bit more insight. Okay, very hard question. So if you picked admission, you're not entirely wrong. But think about this, the laws in psychiatry that we learned yesterday, right? It says, O'Connor says, hey, you cannot put someone in admission if they just because of mental health condition. Think about Rainey. If you were in my class yesterday, you know I don't say the whole name, try to say brain power for you. Okay? So think about that. It means that, hey, they can refuse treatment even if they're admitted in the involuntary admission. Okay, let's keep moving on. Good job, everyone. And remember, every time you get a question wrong, that's more important than getting right, because now you're learning. Okay, very good. As I assume, some of you guys would pick the green option, right? Again, you're not entirely incorrect. The best answer is the blue answer. As a PMHNP, you are qualified to prescribe medication. Now let's break this down for the test. For the test, when you have someone with anxiety and depression, and their score, let's say PHQ-9, with symptoms of depression is 5, what do you do? Anyone can speak up.
Monitor.
Not if it's
What was the question?
okay. So you have John, 25 years old, male, comes to you with symptoms of depression. He's inquiring about medication. His PHQ-9 is 5.
No meds just yet.
So what do you do?
Therapy.
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 Therapy. Now, Sam John, 25 years old, his PHQ-9 is 15. What do you do?
Meds.
You can do either or. You can do both.
Yes.
You can do meds or both, right? Now, the same patient, his PHQ-9 is 22. What do you do?
He needs meds for sure.
Meds.
Meds.
Therapy.
Okay, let me repeat
Monitor
the
for
question.
SI.
Let me repeat the
For suicidal. Monitor for suicidal. Monitor for
Okay,
suicidal.
I heard you.
You check for
Okay,
suicide.
I heard you. Please mute your mic for a second there. But I heard somebody saying meds, and I heard somebody saying assess for suicidality. The right answer is assess for suicidality. Somebody said for sure needs med. That is incorrect, right? So let's break this down again one more time because it's an important point. And that's why I say this is a hard question because it didn't give you much of information, right? But on the test, they'll give you more than symptoms. They'll give you a score of PHQ-9, and that is what will drive your answer. Let's break it down. PHQ-9 less than, roughly than 9. Consider minor depression. At that point, no meds. All you offer is therapy. Now the PHQ-9 is anywhere between, let's say, 10 to 15. Well, let's increase the range. Let's say 10 to 19, even 20. It should be okay. Then at that time, really your focus is medication. Now, when there's more than 20, let's say 21, 22, right? At that time, it's pretty serious. So at that time, it's no longer meds. Your only intervention, your initial intervention, not only initial intervention, is to assess for suicidality. So your options will be PHQ-9 is 22, 21. Your option is A, start Zoloft as it has been shown to be very effective for major depressive disorder. Option B, assess for suicidality. Option B will likely be the correct answer because the PHQ-9 is too high at that point, and your priority is assess for suicidality. Okay, very clear. And that works also for GAD, but mostly those questions are related to PHQ-9. Any questions about that? All right. Good job, everyone. Next question. All right, we have 10 seconds left. Two seconds and done. All right. So why not A, right? Refer the patient to substance abuse counselor for MAT, right? Medication assisted therapy. Well, that is passing the bucket. If it's something that you can do, you should never delegate, right? So that is passing the bucket. So assess the patient for MAT, and if appropriate, initiate treatment. So that is the book answer. Assess first and intervention if needed. What else? So, okay, that's the only two answers that are applicable. Great job, everyone. But that's important. So when should you pass the bucket? When you encounter neurological symptoms that are not the core of what you do, for example, Rett syndrome, but still, if the answer says collect labs, do a test, and then refer, that is the best answer because you're doing something before you refer. Let's say, for example, I find someone with low testosterone or symptoms of low testosterone, and I'm thinking, gee, is this major depressive disorder in itself, or is this possibly a low testosterone? Let me go ahead and collect some labs for low T and find out, and then I will refer after that because I don't want to manage that, right? Now, who has a question there? Brandy. Go
Yeah,
ahead.
I got kicked off. Can I get another link? Because it just kicked me off.
Yeah, so you just go to www.kahoot.it.com and then you enter your PIN code, which is 8079894. Okay. All right. Before we get the other question, go ahead and if you have a question, what is your question? I think was can't see who asked the question. Is there any other question? No? Okay. All right. We'll keep on going and you just be able to join in on their next question. Hard question, right? Okay. Very good. Now, why is the brown option not a better answer? So let's compare. Respect the patient's autonomy and provide outpatient treatment. It is like saying, hey, I think you should be admitted. And the patient says, I don't want to be admitted. And then I say, okay, here's your appointment for tomorrow. You can come back and see us in the morning. Compared to, hey, I think you should be admitted. I think these symptoms will develop in these situations, or this could happen to you. Would you be willing to be admitted? Once you get admitted, we'll work through this plan with you and assess for safety, right? At the moment. So this is a more comprehensive answer rather than just saying, hey, would you like to be admitted? The patient says no, move on. Here's your appointment for the next day. So look for an answer that's a more complete, an umbrella answer. We talked about umbrella answers yesterday. Now, you will encounter for every question the answer and the second best option. So the second best option is respect the patient's autonomy and provide outpatient treatment option. But it does not trump assess for safety, assess for, hey, let me explain the risks, and then you can make a decision after that. Okay. Nevertheless, a hard question, right? So it really is a balance between respecting the patient autonomy and ensuring their safety, right? Okay. Okay. Very good. Take a look on the rationale. Okay, so initiating hospitalization referral due to the presence of suicidal thoughts. This situation addresses the patient's occasional thoughts of self-harm, which is a serious concern. Suicidal thoughts warrant and then immediate attention should be considered a priority. Hospitalization may be necessary to ensure the patient's safety and provide intensive therapeutic intervention. So the question is, when the patient has suicidal thoughts, should they be admitted? No, they should be reassessed, right? Now, if it gets to be a plan, then it should be an admission. And can be some nuances. So you really have to read the question on your test date to figure out, is this enough for an admission? Is this enough to take someone's liberty? Or no, right? Go ahead, Queen. Please ask the question. You have to unmute yourself. Now, let's compare, if you're stuck on this one, let's compare adjust the current medication and continue the outpatient treatment. That's not a better option. Recommending the patient to seek alternative therapy. That's not a better option. Referring the patient to a support group for individuals with mood disorder. That is not a better option. So even if you can fight and say having suicidal thoughts is not necessarily an admission process, still better than those other options provided. Okay, we'll keep on moving, and then if you have a question, you can ask on the next one, please. I couldn't hear you. Okay. Nine, I mean 807-9894 is the PIN code. I'll write it down in the chat here for you. Let's discuss this question. So 807-9894 is the PIN code for today's event. I wrote it down. All right. So the question said occasional suicidal thoughts denies any plan. Okay, denies. So it's very strong. The question said that denies suicidal plans, right? So if there is no plans, I'm not thinking about it. I just wish I would not wake up today. These are morbid suicidal thoughts, but I have no plans whatsoever in doing so, right? So what do? You adjust your SSRIs or your medications, and you continue to monitor the symptoms compared to initiate immediate hospitalization due to suicidal thoughts, compared to discontinue her medication and send her to send her to psychiatrist. That is passing the bucket. That is the wrongest answer you can ever do in your test. If you say, it's like you saying, what the psychiatrist can do, I cannot do with my license. The board does not like that. Although there are things that they can do and we should not, but there are very, very few in between. Very, very few. So every time you say, I'm going to send you to a psychiatrist, that's 99% of the time, depending on the question, incorrect. Start cognitive behavior therapy session to address her symptoms. Possibly. the next best answer, right? But is that more important than adjusting her medication and continuing to monitor her symptoms, right? So therapy will take time, right? It works. It's wonderful. I try to put at least 15 minutes of therapy for all my notes, for all my encounter, because it's very helpful. People are looking for hope. As a PMHNP, what you are doing is science and hope, and you marry those two together and you deliver to your patient the science and the hope. Okay. All right. So this is a little bit different, right? I already have a plan and I have a desire to die. So this is more, whether it's voluntarily or involuntarily, it's most likely an admission, right? Would be even a stronger answer is collaborate with the patient for a voluntary admission, right? That would be a stronger answer. But whether it's voluntarily or involuntarily, this is a pretty sure patient that is a good candidate for admission. Okay, so collaborate with the patient to develop a safety plan and prescribe more meds. At that point, when the patient already has a plan, already has medication, and says, I want to die, it already crossed the line for a safety plan. Okay, what I do not want to do is prescribe more medication. It's already started collecting medication as part of the plan. Okay, so here is what I do when I have someone like that, or when I have someone, I see my patients the day after 24 hours discharge, and then I initiate my medications. Do you think I give them a 90-day bottle? No. Do you think I give them a 30 days bottle? No. I'll put 6 refills of 14 days. Give and take, right? It's more inconvenient for the patient, but I am assessing the risk. I give them 14 days rather than 30 days. Now, can they go out and still buy other substance? Yes, they can, but it's not coming from me, right? It's something that I do. Not saying that you should do that way. You may prescribe 30 days. That's fine, but I'm comfortable with 14 days after, for at least for the first 2 months, and then I increase, or the first 30 days, and then I increase depending on the patient. 5 seconds. Pick your answer and go. All right, great to see that everyone, most of you guys got it correct. Now, again, same situation in a different format from the previous question. Which one is the better answer? Respect the patient autonomy and decision to discontinue the medication. It's like a schizophrenic patient says, hey, I don't want to continue my medication, and my response is, okay, I respect your autonomy. Compared to, hey, I don't want to continue my medication, okay, let's discuss the risks so you are better informed. Here are the risks, here are the benefits. What do you think would be the best option for you? Working with the patient, it's always the best option. Allowing the patient, your job is to inform them the risks and benefit. And we discussed this yesterday, informed consent, the risks, the benefit when we do informed consent, right? So similar situation. The consent already been given, the patient is already on the medication, they may be struggling to remember what are the benefits. They're feeling better now, they no longer need. This is a huge pitfall for any patient, especially major depressive disorder. They're doing great, 6 months, feeling great. And they say, I don't need it anymore. And they stop taking it. 2 months later, they come back and they're like, oh, it's so hard to get out of bed, right? What happened? You're doing wonderful. I stopped taking the medication. Why did you do that? What was your rationale? I didn't think I needed anymore. I see this all the time. That's why when I do my clinicals, I emphasize what the pitfall, what's likely how they'll feel in 30, 60, 90 days, and where most people fall off. So I emphasize that a lot. Five seconds. Take your answer and go. All right, I'm glad most of you guys pick do not inform the parents. It's not 19 years old, right? So inform the parents about his substance use due to safety risk. If the patient says no, yesterday we went over emancipated patient. We went over when to tell the parents, when not to tell the parents, depending of the age. And sometimes you are in this bind. I want to tell the parents, but I really can't, because the moment you do, you lose trust with the patient may never come back to you, right? In this case, it's a 19 years old. It's a break of confidentiality. You're in serious trouble. If the patient says, no, I do not want you to disclose this information, then the answer is no. If you do, I wouldn't say you lose your license, but you'll be in trouble. You'll be in serious trouble. Okay? I have seen at least 5 people losing their jobs because of HIPAA violation. And some of them were not that serious. Looking up a patient in the yard when they had no business in it, and the patient found out, and they got mad, filed a report. The provider was fired. Right? The patient didn't get a report. The person in the yard did not call. It was not his patient. He was just curiously looking the ER patients for the next admission, right? And the patient didn't like that. So be careful. All right. So respect the patient's autonomy and involve her in the treatment decision. Now, Kahoot, I cannot give you a long answer. It only allows me to give a small amount of characters to complete this answer. Good job, Ray, a believer, Mitch, Congo, and Mitch. All right. So here is the correct answer, right? Respecting the adolescent autonomy and confidentiality while involving her in the treatment decision is in line with the ethical principles, right? PMHNP consider the participants' wish and involve the parents as appropriate without disclosing information without the patient consent, right? You will be getting questions like that that will put you in between two possible answers. Ask yourself, is this a safety risk? An absolutely safety risk? If the answer is no, then involving the parents most likely the incorrect answer. Okay? So it is a hard question because it really depends what the question says. Jeanette, do you have a question there?
Yeah, I was wondering, this is a minor, so we don't involve the parents in the treatment plans?
Okay, great question. So in the treatment plan is one thing. If the patient says, no, I don't want to, is a 17 years old, then most likely you will not involve the parents unless if there is harm to the patient. So what would be a harmful situation? Let's say this is a 16 years old boy or girl, doesn't matter, and she's having a relationship with a 35 years old, right? In that case, it possibly could be a safety concern. Then you involve the parents. For example, can a 14-year-old make decision if he does not want the parents? It really depends, guys. So there is no 100% answer. The answer is that a safety risk? If the answer is yes, then involve the parents. What happened is a ethical dilemma between the parents and the patient. The moment you involve the parents, without the patient's consent, you have lost the patient forever. There is nothing you can do. How do you keep trust with adolescents? By keeping your promise, but by not telling the parents. That is high yield information you need to know. By not telling the parents, you are gaining trust. Now, when do you tell? Well, when there is a safety risk, when there is a risk harm self or others, then you tell. Okay? So will depend for every question. You have to ask yourself this question. is that a serious safety concern? If it is yes, involve the parents. If it's no, keep it a secret. Look for an answer in which you coach the patient to involve the parents, but you are not making the decision alone. Okay, that would be the best case scenario. Look for an answer that you're coaching. I think you, I think your parents would be very understanding of this situation. You are going through a hard time. Would you mind if we together talk to your parents? That would be a strong answer. You're asking for permission. You're trying to collaborate between both parties, right? But you do not go behind the patient's back and tell the parents. You do not say, well, thanks for telling me. I'm going to tell your parents now. So see you next session. You probably not. Sorry, Queen. I'll answer your question. Please keep your question because I can't stop the game now. I believe it's Queen. Yeah. We went over the ethical principles yesterday and how they can actually morph into another. So make sure you fully understand the ethical principles that we covered yesterday so you can ace your PMHNP board certification. 3 seconds. Okay. So if you want to, not obligated, why, if you pick beneficence, why would you pick that? What are your rationale so we can work through the problem?
To do good.
To do good. Okay. Give me an example of how questions would come to do good. What kind of example would that be?
To
So can I give you an example?
yes, go ahead.
Okay. So if someone has a major depressive disorder and I prescribe them SSRI, that is beneficence. Now, if the patient is telling me I do not want this, I am respecting the patient's autonomy to make their decision. Although I'm the provider, I cannot force anyone to do anything they don't want to, unless if it's a serious safety risk. Most of the time, 99%, I'm here to teach, mentor, and coach the patient towards recovery. I cannot say you will do this. Is it a little bit clear why autonomy is a little bit better than beneficence? Or no? I can't hear you if you are talking. Now, maleficence, on the other hand, has nothing to do with this question. If you were in our class yesterday, hopefully you fully understand non-maleficence. We gave an example, trazodone, that could cause priapism, a erection that's not involuntarily erection in the middle of the night. That's a serious medical concern. So if I withhold the medication because of the side effect, then this is the case of non-maleficence. I also described the case in where I would hold Adderall for someone that had history of seizures, alcohol abuse, and possibly taking more than prescribed Adderall or selling Adderall. So I withhold the patient medication due to the principle of non-maleficence. So if you guys are confused on this topic, please let me know so we can clear it up. I have no doubts you will get questions on ethical dilemmas. And if you don't know them very well, it is likely that you could miss 1, 2, or 3 questions. Okay? Any Queen, you had a question before and I skipped you. Would you still have a question? You have to unmute yourself if you're talking, guys. I cannot hear you. All right, then we are moving on. I'm not sure if Queen is there or not. So, next question. We have 10 seconds. Pick your best answer. 5 seconds left. All right. Again, third question in the same scenario, a little bit of twist. Respecting patient's confidentiality versus discuss parents, discuss the involving parents in the patient's care and explore potential pros and cons. That is a perfect answer. I'm not saying that I am going to tell your parents. I'm discussing with you. Let's look at the pro and cons options of doing so or not doing so. Right? Now, respect the patient's confidentiality and not disclose any information without discussing with the patient the pros and cons, why should you do this, why you should not, is not as strong answer as discussing the parents' involvement and discussing the pros and cons. Now, inform the parents without consent. Again, right? Again, you're saying, hey, I don't care, I don't value your opinion. So I'm just going to tell your parents, right? So umbrella answer, you're not really saying that you are going to or not going to. Let's talk about it. Let's find out what are your fears, your concerns. What are the risks and the benefits, right? Anytime you collaborate with the patient before making a final decision, that is the strongest possible answer. You're not saying that you are going to, you're not saying that you're not going to. We are collaborating on the possible answer, working together to get the possible outcome, right? This is a hard question, okay? It's a hard question. I can see why the blue option seems very appealing, right? But it's about fairness. This question is all about fairness, but it is a hard question. If you work in a ED, right, between patient A and patient B, you have to see which one comes first. Patient A may have arrived 3 hours earlier. Patient B got shot and is coming through the door. You are going to pick patient B, despite the patient A being there for 3 hours, right? It's a life and death situation. Now, when it comes to mental health, it's whatever appointment is available first. We're not necessarily screening them, triaging them to see, okay, I only have one appointment, so I'm going to save this appointment for a possible schizophrenic patient that I may or may not have. And those 9 major depressive disorders, they'll have to, we don't have a place available because I want to save this, right? It is a hard question, but justice, it's distributing the appointments fairly. It is the principle that is trying to convey on this question. Here's the full answer. If you don't know the ethical principles in details, you will miss tons of questions, right? Because here the questions are not that hard. On the test, they will be. So you need to know ethical principles for your PMHNP board certification in details, okay? It will provide lots of samples or examples. All right, so thank you. Again, it's a hard question, right? Because it's not necessarily an ethical principle, uh, but this is about equality of care, and it's about healthcare disparities that we covered yesterday, right? We covered this topic a little bit, is anything that could potentially decrease healthcare service to those in need, right? So you want to advocate for that. And we also discuss how do you advocate. Joining a stronger or strong organization in groups, you are much more powerful than you are alone, right? All right, so most of you, well, actually, let's take a look on the feedback here. Beneficence, which focus on promoting patients' well-being, is a crucial ethical principle in this situation. The PMHNP should prioritize the patient well-being while using strategies to engage the patient in a collaborative decision-making process regarding medications, ultimately aiming to provide efficient treatment while respecting the patient's autonomy. Okay. Ethical principles again, please, 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 please cover that in detail. Again, I don't want therapy. Then you have the principle here is autonomy, respecting the patient's autonomy. If the patient says no, then you respect that. Okay? After this question, Victoria, please ask your question. We have to wait a little bit. All right. So we have to stop therapy or medications. If you're not allowed to, you can't do it, right? You're not in the same state. Depending on which state you are licensed in, you cannot provide therapy on another state. Victoria, you had a question. Before we continue this one, please ask your question. Unmute yourself.
Yes, it was about the question before
Mm-hmm.
because he said stop therapy abruptly. That's why I was kind of concerned about that.
I don't remember it said abruptly,
I'm sorry.
but yeah, I would have to look at it again. It was in the question.
Yes, in the question.
It said that she was gonna stop meds abruptly.
Medical therapy.
I think it was medication.
The question before this one.
Yeah,
There was
we would have.
something-
Yeah, we have to go in the question and look it up again.
Yeah, it said that she was gonna stop medication abruptly.
Okay. Yeah, it's kind of hard. You kind of have to follow up on the question. It's too many questions for us to kind of be able to remember and see which one.
Yeah, that's why I didn't choose that question because I know we don't stop anything abruptly.
Yeah, preferably not to. We have to look back and look at the question. We can do that. Let me see. I'll look at which question we're talking about. We can review that question as soon as the today's sessions is done. I think it might be question number 33 or 31. So Okay, so great. So despite what the patient is on, or what therapy, or what medication, whether it's abruptly or not, if they moved to another state, you cannot prescribe in that state, right? It doesn't mean you wash your hands and you go away. No, you provide resources of who has opening in the area that could pick up treatment. But you cannot prescribe medications if you're not authorized to do so, whether it's abruptly or not. Okay? I'm not sure if the previous question that Victoria had has to do with that or not, but that's something to be mindful. If you're not allowed to prescribe, doesn't matter what the situation is, you're not allowed to prescribe. Please ask your question before we move on. Queen, you have to unmute yourself, Queen, because I can't hear you. Your mic. Here you go.
Good evening, Dr. Lopez. Hello.
Yes, please go ahead. Now I can hear you.
I have a question to ask on the last one regarding uh, the MP has to have a license to practice in that state for the
Mhm.
patient to get the medication.
Yes, what
Is,
about it?
is the MP allowed to follow the patient if she wishes on a different state with the same if she can still prescribe this medication?
I could not hear very well. So is the MP allowed to do what?
But can she also be allowed, if you want to, follow the patient to different state that allows her to prescribe medication to that state for the patient?
No.
Can
I
she still
mean,
do the patient?
I mean, if you are, if you have a license to practice in that state, you can. If you don't, you can't. There is nothing. Now, during COVID, there are some states that did legal documents and they were allowed to. But for the board, the answer is no. No. Okay. If you're not a license in that state, you cannot practice, no matter what the situation is. Did I answer your question?
Yes, I understand that, but what if the MP decide to stay with the patient as long as it's in another state and the MP can prescribe in that state, it's still okay for her to
Yeah.
keep the.
Yeah. If the MP can prescribe in that state, then it's okay. But again, the question is very broad, right? Each state has its own scope of practice. So the true answer is call your state board of nursing and find out if they can or cannot, right? Broadly speaking, if that state allows you to practice and you're licensed in that state from another state, then it's okay. If they say you're licensed here, you can only prescribe in a state of Texas, for example, you can only do that if you're physically in the state of Texas. Okay. Now, it depends on the law of each state. But for the test, if you are allowed to prescribe in that state, then you are within that state, or if that state says, hey, you can be in Maine and prescribe in Texas, then it's okay. All right. Hopefully that answers your questions because I know it can be complicated. Does that make sense now?
Yes, thank you.
Okay. All right. So this is today's event. Shay, right? A believer. And let's see who took number one. Ray. So good job, guys. Then we have Mitch. And how can you take fourth and fifth place at the same time? Oh my God. All right. Good job, everyone. So this has been a awesome event. So before we finish today's event, I believe let me look at the schedule for next week, what is going on next week. And I know we're going to have a summit, 2 days, 2 strong days of the crash course review. Instead of a 1 day, we're going to have a 2 days crash course review coming up, right? So we just went through modules 1 through 5, now the crash course review. Be ready for 2 days, long hours, but we're gonna cover everything you need to pass the board. Everything. So, which means is that if you've been with us for a little while and you're like, I haven't set up a test date, this is the time. If you've been with us for a little while and you're like, I don't know, when should I test? This will be a good time. Maybe 3 days after the crash course review, right? So let me look at the schedule here. One second. Okay, so all our classes, they're recorded, and we also have live recorded classes that we provided to you. Make sure that you are looking at the tabs number modules number 9 and 8. 9 is a previous one-to-ones that I did with the students. Module 10, it is the recorded live events that we are doing, and if you have not been able to participate, you have access to that. So most done here. 1 second. Okay. Let me share with you the schedule. So this is the live schedule. Now, if you can't be with us on the live, that's okay. You can still look at module 10 and view the live event. Now, when you do that and you don't understand something, email me so that way we can clear it up. So today we had Kahoot. Next Friday, we have next Friday, Saturday is Mother's Day. So I wish all the mothers in the room a great day. Mother's Day should be every single day, right? Loving our mothers is the best thing ever. So I do love my mother forever. So Mother's Day should be really every day.
Thank you.
Yes. And then no live class on the 16th. And then we're going to have a summit on the 23rd, 24th. Right? It's going to be 2 long days. If you can't be off work, please be off work. Okay? And if you can, schedule tests immediately after, maybe on the 27th, 28th. If you've been with us, if you have done modules 1 through 5, done your question bank, done your diagnostic test, and you are unsure when you should test, this is a great time to test after the 24th. After you've been to the summit, where we do lots of questions, lots of ways to review the material that we already covered, you should be in a good position to to pass the test. Now, do you have to wait for that? No. The course is entirely self-paced. All you need to do is set up aside 30 minutes per day and keep doing it. Every single day in our group to have people passing. Every single day. So you don't need to wait for after the 24th. I'm just saying this would be a great time if you aren't sure and you want a one last time review of the content, possibly a good time to schedule a test. How do you know you are ready? What is your score on the diagnostic test? It will tell you if you're ready or not. I prefer 80%. Now, we have seen a lot of people passing without having 80%. Do I advise you to take the test? No, because I want you to walk in there with the highest possible level of confidence, right? So we're not rushing for time. We are rushing for the best preparation possible. That's what we want, best preparation. And then you take the test. At this time, it concludes today's event. Any questions, concerns, or problems, or anything that you may feel that you feel stuck?
Dr.
Dr.
Lopez.
Lopez, question. What
First,
advice do you have for some of us that's still in school, like me?
oh, don't rush. Don't rush. We have a lot of people in school. You know, some of them are with us for 6 months. So what I say, 30 minutes a day, no more than 30 minutes, right? 30 minutes, take your time. You don't need to be rushed and then you go from that. Okay? Just a easy pace on a continuous base.
Okay.
But I think I could be mistaken. I think you took the test, diagnostic test, yet last week, right? Or a few days ago, right?
No, no, not yet.
Not yet. Okay, okay. Well, somebody else that scored really high yesterday. It's like, wow, that's impressive. Very impressive, actually. But yes, just continue in a slow pace, but every day, like 5 days a week. And my advice is you finish module one, do not go to module two until you like really could give it a class on module one. You got time. Time is your best weapon. You're starting early. This is it's like a 50% increase of a chance of you passing. Because you're not like, oh my God, I already set up a test date. I have to finish and have to work and have to cook and have to clean and I have to do so many other things, pay bills. So take it slowly. Finish module one, download the PDF for module one. Go through the topics, understand it. Set up study groups with your colleagues. Hey, you want to study module ones with me? Here's the time. You can ask me for a link. I'll provide you a link. And you guys can meet up and study together. At times I will show up, at times I can't. But when I can, I show up. But even if I'm not there, you guys have the material. You don't need me there. Okay? But most important thing is to continuously reviewing the material. Set up 30 minutes a day. And then in your mind have a test date and then backward planning to where you are and where you want to be. All right. Hopefully that answers your question, Cindy.
Thank you so much.
Okay. Pass. Do you have a question?
Hello, Dr. Lopez. I'm not
Oh.
seeing Crash Course Review, Live Review 10.
Okay.
You posted it?
So can you repeat your question?
I'm not seeing Crash Course Live Review 10.
Okay. I will have to look. Let me look on my end here. Yeah, I do not have a crash course review live because let me look at the crash course review because it's located on module training number 7, 8, 9, 10, and 11. Let me share it with you. It is located under the crash course review. So here's the crash course review. So this is the original recordings, developing a successful strategy for PMHNP board certification. Then you have part 1, 2, 3, and 4, and this is where we end. And then somebody says, I wanted a copy of the live review. Then we did the copies of the live reviews. Actually, we did many copies of the live reviews. Too many. I have to delete some of that because it's repeating information. Okay, they're all here. All right, did I answer your question there?
I'm still looking. I'm only seeing.
If you go in the crash course review, module 6.
Crash course review module 6.
Yeah, which is the crash course review. So I put the live encounters there. You don't have to go through all of them because some of them are repeat. Because everyone's like, oh, I want the recording of the last time. It's the same thing as the recording of 2 months ago.
Okay, thank you. I see it now. Thank you.
Okay. Absolutely. Regla, what is your question? How can I help you today?
Hey, how you doing?
Great. How about yourself?
Very good, thank you. What is your advice? My plan is in July, the first week in July. What is your plan for a study?
Okay, so we got May, June, and July. So you got 8 weeks roughly.
Yeah.
1 week per module.
Mm-hmm.
So modules 1 through 6, will get you to 6 weeks planning.
Mm-hmm.
Modules week 7, you do your both diagnostic tests, and week 8 is all about catching up with last minute review, and then the first week of July you test that out. So you do have the perfect planning there, the timing, 8 weeks. Now do this, do module 1.
Mm-hmm.
Do all the question banks on module 1, and then you start module 2, and you do all the question bank on module 2, and then you start module 3. Now, when you start module 3, look at the PDF for module 1 and 2 and revise it. You can do that in 30 minutes because you already went over the situation or the content. When you move to module 4, now you're going to look at the PDF for modules 1, 2, 3, and 4. You're not going through the videos anymore, only the PDF, because you already got this information.
Yeah.
Now, if you really want to accelerate your learning, get the Brainscape app. So that way, if you are at work and you have 10 minutes, 20 minutes, you can start going through modules 1 on the app real quick. In 10 minutes, you'll be able to finish, maybe like 20 minutes, be able to finish an entire module 1. Brainscape.
Okay.
Now you can make your own flashcards, or you can purchase one from us. This is different than our course because we don't own the Brainscape app. We rent the Brainscape app because we think it's a very good way of studying. So it's 3 months. They charge $60, but they sell to me for $49, and I pass it on the savings to you. Now you don't need to buy it. You can make your own flashcards, and that's probably better than buying because you're studying as you make them.
Mm-hmm.
Now, if you want to purchase ours, you can. I actually recommend that you don't and you make your own because it's more effective. When you make your own, it's more effective. Now, if you don't have the time and you really want what we have it already, that's fine. Just let us know. We send you a code for 3 months. They give us a little bit of discount and a little bit more time, and then we pass it on to you guys. But it's not our app either. So, okay?
Okay. Thank you.
Absolutely. CRS, what questions do you have? You have to unmute yourself.
Hello, Dr. Lopez. Sorry about that.
Hello there. Hi.
Please, when is the next class now? The live class?
Yeah, let me look at the schedule again. Because I think I just closed it. All right. So we're in May 3rd. So next weekend is Mother's Day. So we're not having a class.
Okay.
The following weekend, I am traveling, so we're not having a class. I'll be in the airplane. And then we have a class on the 23rd and 24th of May. And that is
Okay.
the most important class. It will be 2 days class, back to back.
Okay.
No
What
Kahoot.
time?
Same times, 5 p.m. Eastern
Okay.
Standard Time. And then we'll have about 6 hours of class, 5 hours of a class on each day. It will be the most important class. So if you have an ability to now work those days, it would be very helpful to you. Instead of framing this material and say, hey, here, take it. We're going to go in detail for 2 days. We're going to
Okay.
spend about 10 to 11 hours, how long it takes, so that everyone can master this material in 2 days. So Crash Course Review Part 1 and 2. I don't
Okay.
want to rush the content. I just want to make sure that your guys are good to go. So make sure if you can attend this live event. This is the
Okay.
first time we're breaking down so that we can give more content in 2 days in a row. All right.
Thank you.
Okay. Yeah, everyone else, glad to see you here. I'm super stoked. This week we had fantastic results like every single week. Every single week. You guys are crushing it, you know. Keep doing what you're doing. I know sometimes it can be tough. I know I ask a lot. I know that I put you guys through the hoops here sometimes. They'll be like, do this, do this. But the thing is, if you prepare so good, so well, that the test will be nothing. He'll be nothing. You'll be laughing at the test. And this is how you want to walk in a test center. Like, here's my name, give my certificate, right? I'm done. So prepare. Leave no stone unturned. Make sure you know your content. Love the journey, pass the board. And this is the end of today. Unless if anyone else has any other questions or concerns, I think I will stop recording. I'll post this on YouTube. You guys can review, revisit if you like to.